You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Bark and Wag is excited to announce our new partnership with a Colorado hemp farm to produce a line of CBD products for your pets. Bark and Wag has CBD pet tincture available in 300, 750, 1200, and 2400 milligrams. Bark and Wag CBD is pet safe, no THC, it's made in the USA, and is CO2 extracted. Please check out Bark and Wag's website, barkandwag.com. That is BARK, to see our line of CBD and awesome merchandise. We love pooch ideas for podcasts and merchandise, so anytime send an email to Polly at barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Jennifer Jones Shults about arthritis. Welcome back.
Thank you so much.
Well, thanks for being on the podcast, and I wanted to talk about arthritis. What are the signs? What do we do? And how can we help our dogs be as comfortable as we can make it?
Yeah, arthritis is the most common orthopedic problem we see in dogs. And so some dogs can be affected quite early in life if they're born, say, with severe elbow dysplasia or hip dysplasia. More commonly, I think our owners think about it as their dogs get older, their joints don't move as well as they used to, and that limits their mobility and what they want to go and do. So I think it's important, if you see that your dog's not moving as well or limping, don't assume that they have a sprain. We want to get them an exam and find out what joints are affected so we can be as early intervening in these processes as possible, because we have so many great options to slow down the progression of arthritis before it becomes something that your dog is in pain every day.
So what are some of the things that you can do? Obviously, keep weight off the dog?
Yes. Okay. Keeping a nice lean body weight, and that means being able to feel your dog's last rib easily. Even in a fluffy dog, you should be able to feel it. We want to make sure that they're getting some activity every day, so they don't have to go out and do an Ironman, but getting out and walking around the block. Movement like that is health for your joints. It pumps the joint fluid through the cartilage to keep it healthy. That's where cartilage gets its nutrients from. So movement is very important. Even if your dog is sore, getting up and even just walking around the house for a few minutes several times a day is really important.
And one of our doggy daycare has swimming. That's got to be good for arthritis, right?
Yeah, swimming is low impact, right? It doesn't have that compression on the joints. A couple things to be aware of if you've never seen your dog swim. Not all dogs know how to swim, so making sure that you're supervising them at first, of course. And remember, too, that swimming is 4 times cardiovascularly more hard, so hard on their heart and lungs, than walking. And so if your dog is not very fit, then you got to keep that swimming session short until we know that they can tolerate that.
Oh, yeah, that's a good point. I didn't think of that. Okay, so now where do they get arthritis? Is it all over or just
So arthritis literally means joint inflammation, right?
Okay.
And so you can have an inflamed joint that look normal on x-ray. So the bony changes we look for on x-ray actually mean that it's chronic and it's been going on for a while. And in almost all dogs, arthritis is what we call conformational. Their joints were not built exactly right. And so the joint wears abnormally and creates inflammation. So like hip dysplasia is what we hear about the most. So the hip joint has this nice socket in the pelvis, and the head of the thigh bone, the femur, should be nice and round and seat deep into that socket. And some dogs are just born with a shallow socket or a misshapen head, and you might not see any problems right away. But as that abnormal wear happens over time, then they develop inflammation and pain in that joint, and they change how they walk and move.
So is that a prescription or is it an over-the-counter drug that can help them?
There's things both ways. From a prescription perspective, the drug that I love the most and like to intervene as early as possible is called Adequan. And it's actually classified as a disease-modifying osteoarthritic agent. So it actually slows down the arthritis process because it's very specific. It targets the cells that make joint fluid to decrease the inflammatory mediator production and increase the health of the joint fluid. So you maintain your cartilage for longer, because end-stage arthritis is when cartilage is gone and you're just having bone rub on bone. So that's the most specific thing we can do for arthritis, and it is prescription, but it's been on the market for 30 years and it's very, very safe.
And obviously you don't have joint replacements with dogs, right?
There are some joint replacements. Hip replacements in dogs have been around for a couple decades now. Elbow replacements are another thing that you might find in specific areas. And there are actually some knee implants as well. It's not a full joint replacement, but for dogs that have patellar issues, kneecap issues that cause arthritis, there are actually some partial joint replacement options there as well.
And breeders will say when you buy a puppy that it's hip dysplasia, the dog is hip dysplasia certified. I think it's like OFA, or is that?
Yeah, there's two different ways to look at hips in particular, because yes, reputable breeders, especially in dogs, breeds of dogs that are noted to have hip dysplasia, will want to breed the dogs with the lowest risk of that, right? So OFA, or the Orthopedic Foundation for Animals, has been around for a long time. And so once your dog is fully grown at 2 years old, you can take x-rays of actually multiple joints. They look at hips, but also elbows and shoulders to confirm that there are no issues. That's a subjective assessment, right? So it's someone's opinion of whether this dog has good or excellent or poor hips.
Sure.
About 10 years ago, the University of Pennsylvania also developed a program called the Penn Hip, which gives you a number as far as how lax or how loose your dog's hips are. And so now we can look at your dog's number against, say, all the Labradors in the world that have had this done to see, is your dog on the better side of that spectrum, or their hips worse in compared, and that can help us make better choices about which dogs to keep breeding.
So when a dog has arthritis, when do you usually see it start to begin? Is it like 5 years old, or?
So you can see dogs with arthritis as young as a year if they really have severe joint problems. So severe elbow dysplasia or hip dysplasia, you can see dogs as young as a year. Certainly, I have some 12 and 13-year-old dogs in my rehab practice that are just getting started. So if your dog is not, taking that full stride, if they come up lame sometimes after play, that's probably the most common thing owners see. The dogs go out, they play hard, and they rest for a little while, and then they get up and they're real stiff. And that's where having your dog have a vet exam and having x-rays of the affected legs taken is really important, so we can diagnose that as early as possible.
Interesting. Because you usually just think it's for the older dogs, but I guess you see it all the time.
Yep. Any dog that has a joint that's not bearing weight equally, and sometimes it's traumatic, right? We see dogs that get fractures as puppies sometimes, and those can affect the joints and cause arthritis as well.
So tell us about your clinic.
So I run a full-service veterinary rehabilitation practice. So we probably see around a third senior or geriatric dogs, a third of dogs that are recovering from injury or surgery, and a third of dogs that are coming in for maintenance and routine care. I see dogs that compete in dock diving and agility and hunt trials. So it's a really good mix. I love seeing all the different dogs, and really what we're here is to improve their mobility so they can have the best active life that they want to. So it's a lot of fun.
Yeah, it sounds like it. So tell me real fast, because I've always been interested in the dock diving dogs, because I have a dog that jumps off the dock like nonstop. What type of injuries do those dogs get?
Yeah, sometimes we see shoulder tendon issues, biceps tendon or supraspinatus issues. or the iliopsoas is a core muscle that's underneath the spine, and they can strain that muscle when they're jumping off the dock because they push so hard with their hind legs, especially if they don't land correctly in the water. So a lot of, strain kind of issues there. And, dock diving, I think, is a great sport for dogs of lots of different shapes. But a lot of our work with dock diving dogs is to recognize issues before they become big problems. They come in and they get spinal manipulation therapy and massages. They start on joint supplements and medications like Adequan to keep their joints healthy because they're athletes and they're putting a lot of wear and tear on their bodies.
Yeah, so we have a summer home up in northern Wisconsin, and one of our labs, she would jump off the dock so many times throughout the summer that one summer she couldn't sit down. And so I took her to the vet, and this is like in the middle of nowhere. And the vet said that she had strained her tail.
Yeah, swimmer's tail. It's especially common in Labradors. Yeah.
So poor thing. She kept like turning around on the dock trying to get comfortable and would not sit down. So I thought, oh my gosh, I wonder if something, happened or anyway. So the veterinarian had to explain that one to my children and I.
Yeah, the tail's certainly important for a swimming dog. I mean, it serves as a rudder, right? And so swimmer's tail is basically they wear out those muscles and make them really sore.
Yeah. It was large too. So we just had to wait for the swelling to go down.
Yep.
Well, thank you for all the tips and talking about arthritis. And I certainly hope that you'll come back on the podcast.
Yeah, I would love to, Polly. Thanks so much.
Thank you very much.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.